The Meet the Expert session on haemoglobinopathies it was my pleasure to do it with Dr. Paul Telfer. He and I chose to take a slightly different strategy. We actually opened it up to the audience. We really wanted to know what they wanted to know and the topic that they wanted to cover. And it was actually a surprisingly long list. We covered most of the topics. The first questions were about global hematology and how many of the things that are being discussed here at BSH and that were discussed in December at the American Society of Haematology, how many of those related to the developing world and what as medical societies we're doing in the developing world. And I think we were particularly excited that there are collaborations that are ongoing between BSH and ASH to begin looking at newborn screening and early intervention in sub-Saharan Africa. And so we could do a report on that and then ask the member to stay tuned, that we're looking forward to seeing some advances in Africa, just as we are seeing them with newborn screening in the UK and also the US. There are a number of clinical trials that are ongoing. So another question that came up during our Meet the Expert session was about new therapies. There are a number of drugs that are in phase 3, and the hope would be that in the near future, if they're successful, that they would be approved. And so we talked about voxelotor, which is from GBT, crizolizumab from Novartis, also revapansel and a few others that are in late clinical trials. I think the key for those is really making sure that we're preparing our patients and their families for the possibilities of new therapies. Up until now, we've primarily talked about hydroxyurea and really trying to encourage more patients to use hydroxyurea. But I think this is certainly a very exciting time to finally see multiple agents that could very well be approved in the very near future for sickle cell disease. I had the privilege of being part of the ASH BSH plenary symposium first thing in the morning in the opening session. The topic that I covered was gene therapy. Gene therapy for the haemoglobinopathies are now reaching a critical phase. And in fact, the EMA, a panel for the EMA just overcame the first hurdle in terms of the initial approval for gene therapy for thalassemia in the EU. And so I think these are very exciting times. For me, part of my goal was to actually familiarize the audience with gene therapy. This is new, relatively new, and certainly quite different approaches for treatment, where the patient is their own donor. So this is a transplant. The patient is their own stem cell donor, and then we insert a healthy copy, in this case, of the beta globin gene using a lentiviral vector in the laboratory and then returning the cells back to the patient. Something that we've talked about conceptually now for decades, we're finally able to, we think, successfully do in the clinical realm. And so part of it was describing some of the new clinical findings. We're actually going to be covering that in 2 abstracts that we presented this afternoon as well. The most recent one on sickle cell is the one that I will cover, and Dr. John Porter will cover thalassemia. What we'll see in both of these is that we're able to achieve production of therapeutic hemoglobin in these patients, and I think we're terribly excited about the possibilities of this being a new cure.